Welcome back, microbiology. Today we're going to be talking about bacterial, urinary, and reproductive diseases. So just to recap what structures we're going to be looking at and how microbes can infect these structures. We've got our kidneys, which are going to feed into the ureters to the bladder, and then the bladder through the urethra. And a few key differences between males and females in this regard is going to be the length of the urethra. For males, the urethra is going to be much significantly longer. The urethra will have two functions in males for both ejaculation and also for urination. Whereas for females, the urethra is only going to be used for urination and it does not have the dual function as part of the reproductive system. So it's separate, whereas in males, you have that dual function, which you'll see why that's important here in just a minute. So for the inner tissues of the urinary tract, these are usually going to be sterile. So as you move up, sort of more internal and up, the probability of having microbes there is going to be low. And if you do end up with microbes there, then you're probably going to get an infection. So the kidneys, the bladder, the ureters, once you get to that point, the bladder, there should not be any microorganisms. Now the external openings, because that's more exposed, you are going to see microorganisms. So the flushing of acidic urine, and this is why males will be less likely to have an infection in the urethra, is because the urine is always flushing it out. Now females also have that advantage as well, but the vagina does not have this constant flushing of urine, so the vagina can be more prone to infection by microorganisms. And it's supposed to have microorganisms in there like lactobacillus, which we'll talk about here in just a minute. So these microbes can multiply and cause infections if you have some type of obstruction or a narrowing of the urethra, or if someone just hasn't been hydrated properly and they're not urinating frequently, then they're not flushing out those microbes. And the urine not only flushes out the microbes, but it creates an acidic environment that makes it very hard for the bacteria to survive it. So some different terms for the infections that you'll have in the urinary system. We have urethritis, so that would be an infection of the urethra. Cystitis would be an infection of the bladder. Ureteritis would be an infection of the ureters. And then pyelonephritis would be an infection of the kidneys. So what are some sources of these UTIs? Well, most of the time it's going to be opportunistic pathogens. So microbes that could enter from an external source and someone has been using a catheter or they have been taking antibiotics and they killed all the normal bacteria. And then these opportunistic pathogens can start to inhabit the area. In females, because now this wouldn't be for the urinary system, but the reproductive system, because they do not flush out the vagina with urine, then they can be more likely to get these pathogens into the vagina because it's not being flushed out. So for cystitis, that would be the bladder infection. Symptoms of this would include painful urination, the sensation that the bladder is not empty even after they have urinated. So if you feel like you're always having to go to the bathroom and you still feel like you need to urinate even after you have urinated, then it could be the case that you have a UTI. If there's any kind of cloudiness or blood in the urine, that could definitely be an infection of a bladder, indication of a bladder infection. And this is going to be much more common in females, again, because this urethra is shorter, so it's easier for microbes to move to the bladder because it's just a shorter distance. So even though it's being flushed with urine, the distance is so short, it's more likely that they can move up into the bladder. So some symptoms, other symptoms we might see is dysuria or pyuria. So dysuria would be you have that difficult, painful, urgent urination, and it's very frequent. And then pyuria is when you have leukocytes in the urine. And this is primarily going to be caused by E. coli and Staphylococcus saprophyticus in the bladder. So for pyelonephritis, this would be when you get an infection that reaches the kidneys. So they're able to move through the ureters, that's going to be their entry point, and eventually they could actually get to the kidneys. So usually this is due to the ascending urinary tract infections, so those UTIs where the bacteria move up through the ureters, and the bacteria just get to the kidneys from that access point. So while most kidney infections are going to be caused by bacteria, you could also have a virus cause pyelonephritis, even though that's going to be less common. So some symptoms of pyelonephritis, well, because this is infecting the kidneys, then you might experience back pain. You could also have a fever. If it progresses and it's not treated, it could actually cause someone to die. So usually the treatment is going to be intravenous third-generation cephalosporins. So the reason it creates back pain is because if you remember, the kidneys are located in that retroperitoneal space towards the back. So inflammation in that area directly affects is where you would feel it, is in your lower back. So you experience pain. Now that inflammation, it could be mild and you might get a dull kind of aching pain, or as it progresses, that pain can become severe. It can feel like someone is stabbing you in the back, is often how patients describe this. And it can be accompanied by, of course, fever, chills, and then those urinary issues that we talked about with cystitis, such as painful urination, increased frequency of urination, and just that sensation that you always have to go to the bathroom, even right after you have drained your bladder. So that's what it might feel like, some of the symptoms. And when you see that term third generation cephalosporins, it's just like when you see like phone companies or tool companies, they'll say like second gen, third gen of that product. It's the same thing here. These are modifications of those initial cephalosporins that scientists have done to modify them so that they're still effective as the bacteria have become resistant to the first and second gen cephalosporins. So they modify them chemically so that they will continue to work even though some of the bacteria have evolved past those initial versions of the antibiotics. So an interesting type of infection would be something called leptospirosis. And this actually comes from animals. So we call that a zoonose. So what it can do is it can infect the kidneys and liver. And it's caused by this Leptospira interrogans, and that is a type of spirochete. And it looks like a question mark, as you can see here to the right, with like a double question mark if they're backed up together. So what happens is animals who are infected with this Leptospira, then they actually excrete it in their urine, and then that could get into the water, depending on where it is. This is actually very rare in the United States, but it still does happen. If you contaminate water from a drinking source, it's much more common in third world and developing nations. So humans get this from animal urine, and it can get into our cuts or abrasions, or we could get it into our mucous membranes, and it can cause infection. So the symptoms you'll see with this, you might get a headache, you'll probably have muscle aches, muscle pains, and then a fever and chills. And the way that comes is through animals urinating onto soil, potentially that are into water, and then that water is used to clean food or to rinse food off from just a natural source that animals have been in. And then even though you didn't directly drink the water, you ate food that had that water on it, or you were just exposed directly to the urine of the animals, and you can get leptospirosis. So I was reading this paper about the pathophysiology of leptospirosis, and I thought this quote was interesting, just kind of summarizes what can happen from it. So it's described as an acute septicemic illness that affects humans in all parts of the world. Approximately 10% of patients with leptospirosis develop severe disease, the Weil syndrome, with jaundice, acute kidney injury, what they abbreviate AKI, and pulmonary hemorrhage, which will be like bleeding in your lungs. So that leptospirosis-induced AKI is typically non-oliguric with a high frequency of hypokalemia. So if you see that term pathophysiology, just think the way that the disease affects us. So what are the changes that accompany this disease? And that's what this paper looked at. You see that term Weil's syndrome or Weil's disease? That is a severe form of leptospirosis where you actually get liver and kidney damage. Because your liver gets damaged, you experience jaundice, that yellowing of the skin, and that buildup of bile. You see that term non-oliguric? That would be a state of reduced urine output. So urinating less than 400 milliliters a day in adults. Um, Now that's not as low as oliguria, which would be less than 100 milliliters per day in adults. So in the context of acute kidney injury, non-oliguric AKI indicates that while kidney function is impaired, urine output could still be within a certain range, unlike oliguric AKI, where that urine output is significantly reduced. Now, how common is this? It actually is really common in other nations. In America, it's very rare. They have about 100 to 200 cases per year. But globally, there's about 1 million cases per year, and about 60,000 people will die every year from leptospirosis. So globally, it's actually pretty serious. But even if you are infected with it, 90% of the time, you're not going to have severe symptoms. They'll be pretty mild. So that brings us to infections of the reproductive system. So we have our male and female reproductive systems here contrasted. And just to kind of recap the differences and where you might see infection. So for the female reproductive system, of course, we have the vagina, then the cervix, which is that space between the vagina and the uterus, and then you have the fallopian tubes and the ovaries. And you're going to have a lot of microorganisms in the vagina, not near as many in the uterus, and then it should start to become sterile from there. It was once thought that the uterus was actually completely sterile, but they now know there are some natural organisms there, and they call that the uterine microbiome. Now, for the male reproductive system, we have the testes, you'll have the rete testis, and then you'll have the epididymis, the vas deferens, and then we have the seminal vesicles, bulbourethral glands, and then you have the prostate gland. So you got a lot going on here. Now, the bladder will be just over here, and that's going to be flushing out this urethra for the males. So there's a constant flushing out. So while the end of the urethra is exposed to more microorganisms, because it's the most exposed part, once you start moving up here, you shouldn't have microorganisms. This should be sterile because it's constantly being flushed with urine. So, some reproductive system characteristics. These microbes are very sensitive to environmental stresses. So it requires intimate contact for the transmission of these microorganisms. So most are going to be transmitted through sexual contact, and we call those STDs, which stands for sexually transmitted diseases. So more than 30 bacterial, viral, and parasitic diseases are described as STDs, and because many of these are bacterial, they can be treated with simply antibiotics. And then, of course, most could be prevented, actually, with the use of condoms or contraceptives. Now, why do STDs exist? There are some interesting evolutionary explanations for this. One of the thoughts is that actually for a population, monogamy is more beneficial to the survival of a population than polygamy. And there's many reasons for that. One of them would be that monogamous relationships and then rearing parents in those rearing children in those relationships provides a more stable environment for the children to grow up in. The children will have a large amount of exposure to both a mother and a father, which we know psychologically is extremely beneficial for a developing child. So a monogamous relationship gives each child more attention from both parents, which is good. And it also creates a more stable society and culture versus where you have a lot of jealousy, a lot of envy, little attention to the children, which isn't good. So monogamous relationships are just better for societies. So one thought is that STDs actually promote monogamy and has actually led to more monogamy globally, because when people are in these polygamous relationships, it's more likely that they start to spread these sexually transmitted diseases. So we'll look at some examples of STDs. One of those is gonorrhea, and this is caused by Neisseria gonorrhoeae. And it's one of the most common reportable communicable diseases in America. And it's interesting, it's actually more common in certain areas than others. Now, it's caused by this gram-negative Diplococcus bacteria that you see here on the right. The name gonorrhea comes from two Greek words, gonos and rhea. And gonos means semen, rhea means flow. So the name actually literally means semen flow. And there's some interesting reasons why it has this name. Um, Another nickname for this is actually called the clap, and that was due to this French word for a brothel, which is clapier. And this disease would frequently be contracted in these brothels, and that's why they gave it the name, the clap, because it's basically called the brothel, because that's where you would get this disease. Another explanation for the nickname, the clap, was actually due to like how they would treat this in the early days, where they would basically slap both sides of the penis extremely hard to try to push the pus and the discharge that would come from this infection out of the urethra. So, a couple reasons why they have that name. Now, it's been on the decrease in the United States, except for in Alabama, because a lot of rural areas, states that have more rural areas, oftentimes their sort of philosophy around sex is more religious, and it's usually to tell people to abstain from sex rather than to provide them with contraceptives to use in sex. So it's more likely to be spread in those areas. So Alabama has actually had an increase in gonorrhea. You'll also see co-infections of this with chlamydia. And a lot of times you'll see this in younger sexually active males and females. So there you can see that Diplococcus bacteria floating around and some white blood cells trying to destroy these. Here's a map of the United States where you can see where it is more frequent. You'll notice here, sort of in the southeast, is where we have a high increase. So some differences between males and females with regards to gonorrhea. If a male has an unprotected exposure, there's about a 25 to 35% chance that they're going to get gonorrhea. In females, it is significantly higher. It's almost like they're guaranteed to get it if they have a single unprotected exposure. So more common in females. In males, they're going to have that painful urination and that pus discharge from the urethra. In females, the cervix will be impacted, which has those columnar cells. That's where that infection is going to occur. For females, the symptoms are not as obvious, whereas males are much more likely to see symptoms and see them sooner. So the infection in males and females could become systemic, where it affects the body as a whole or other areas of the body besides just the reproductive. So some different types of gonorrhea you could have. You could have gonorrheal endocarditis, which would be inflammation of the heart, gonorrheal meningitis, where you have that inflammation of the meninges, and then gonorrheal arthritis, where you're going to see that to start infect the joints. You could also have ophthalmia neonatorum, which is where the eyes of the newborn become infected when it passes through the birth canal. Pharyngeal gonorrhea, that could come from oral sex, which would cause a sore throat, and then anal gonorrhea, which would be from anal sex, where you get pain, itching, and pus formation in that area. Now, if it's not caused from gonorrhea, then we call that non-gonococcal. So if it's urethritis and it's not caused by gonorrhea, we call it non-gonococcal urethritis, and they abbreviate that NGU. So this could be caused by chlamydia trachomatis, and this will infect the same columnar cells as gonorrhea, and it's most commonly sexually transmitted pathogen in the United States. Causes 4 million cases of NGU annually in the US. So it's very common, and it can also cause PID, which is pelvic inflammatory disease. So chlamydia trachomatis can cause something called lymphogranuloma venereum, and they abbreviate that LGV, and this is also an STD. It causes genital blisters in the first stage of this disease. When it progresses to the second stage, it leads to swollen, painful lymph nodes in your groin, pelvis, or rectum, as you can see in these images here, hence the name lymphogranuloma. So antibiotics, because it's bacterial, can be used to treat LGV, but if it's left untreated, it can cause long-term damage to your lymphatic system, and it can increase your risk of getting other diseases, sexually transmitted diseases, as well as HIV. Now, this is going to be more common in tropical and subtropical areas, and this is actually very uncommon in the United States. The only place you see it more common in North America is actually in men who have sex with men because it's spread very easily through that instance. So not really that common actually in the United States. So for a comparison here between males and females for non-gonococcal urethritis or NGU, for males, the symptoms are going to be mild. So it might even be asymptomatic, and it can lead to inflammation of the epididymis. So in females, it's reported in 5 times as many women as men, and it can cause this PID, or pelvic inflammatory disease, and then it can also cause those eye infections that we discussed. Now, eventually, it can actually lead to scarring and sterility. So what is PID? So this is a collective term for any extensive bacterial infection of the female pelvic organs. So we're talking about the uterus, the ovaries, and the uterine tubes. 1 in 10 women of reproductive age will experience PID, and it can lead to infertility and then ongoing pain. So it's often caused by Neisseria and a co-infection with chlamydia. You'll see those paired up a lot of times with PID. So it's carried from the cervix to the uterus on sperm, and we'll look at what that looks like here in a second, where the bacteria are literally attached to the sperm cells themselves. So the most serious form of PID is salpingitis, which is inflammation of the tubes that results in scarring and sterility that we mentioned. And that can actually lead to the prevalence of ectopic pregnancies. So for Neisseria gonorrhoeae, this is just a little research paper on this. It's actually really old, from the 70s. But when they started to study this, they noticed that the sperm cells that are covered in this Neisseria gonorrhoeae, some of them have pili that help them stick to the sperm better than others. So pileated means it has these piles for adherence, and the ones that do are more virulent because they attach to the sperm better, in which case they're going to be able to move to the cervix more efficiently. So here it says that pileated type 1 Neisseria gonorrhoeae attach to 50% of human sperm after incubation of mixtures in vitro for 15 minutes. In contrast, non-pileated type 4 Neisseria gonorrhoeae attach to only 23% of sperm. So if they're able to stick to the sperm better because they have these pili, then that's going to increase the virulence for that condition. So next up, we have syphilis. This is caused by Treponema pallidum, and this lacks the enzymes necessary to build complex molecules, so it relies on its host to make the compounds needed for it to live. It's a non-sexually transmitted strain. One of those, the non-sexually transmitted form, causes what's called Yawls, which is a skin disease, and it is transmitted by sexual contact of any kind. So the case prevalence, the frequency hasn't really changed much as of late. And what's interesting is back in the day, some states actually had to require that before someone got married, they would have a syphilis test. But the actual positive cases of that were so few that they ended up doing away with it. Now you're going to see this most commonly in those in the inner city that are maybe economically disadvantaged, and then prostitutes who are drug users are going to be at the highest risk of an infection of syphilis. So it's caused by that Treponema pallidum, and that is a weak staining gram-negative spirochete. If you remember when we talked about spirochetes, so the gram stain is difficult because their cell wall is so thin. So that's why it would be weak staining. It doesn't retain much of that dye. So it's transmitted by sexual contact of all kinds, has an incubation period of 3 weeks, and has several stages that we'll look at. We're going to go through each of these, but if you want to pause it and just look through this graphic to kind of paint a picture of it, you can, and then we'll go through each phase together. So the first stage will be the primary stage of syphilis. This is where you get a small hard-based chancre, which would be a sore, and that would be at the site of infection. So the chancre is painless. It has exudates of serum in its center. The serum is contagious. And then after a few weeks, that will actually disappear. And for males, you would actually see this, but for females, because it's internal, they might not even know that they have it because it's going to be an internal chancre, and they may not be aware that they had syphilis in the primary stage. So bacteria enter the blood, and then they enter the lymph in that primary stage. For the secondary stage, you might see skin rashes appear. Hair might be falling out in patches. They'll be weak, and they could have a mild fever as well. So they could have this rash in the mucous membranes. The rash lesions contain virus sheets, and they are infectious, just like the serum from the chancre. So healthcare workers who come in contact with this fluid could become infected if they have minute breaks in the skin. So you'd have to be careful in working with someone who isn't in that secondary stage of syphilis, that you do not have any abrasions that could become infected from those rashes that they have. So non-sexual transmission is possible, although that's much less likely. And the symptoms for secondary syphilis could last a few weeks. And again, all the while, because this is bacterial, this could be treated with antibiotics. Now, what happens next? So you have, a few days, a few weeks, and then a few more weeks, and then you end up with what's called the latent phase. This occurs when the symptoms of secondary syphilis go away. There are no symptoms during this stage. So this stage can last 2 to 4 years. It is not infectious, except in the case of a mother, and it can actually be passed to the fetus. So about 30% of untreated syphilis cases will progress past the latent stage to the tertiary stage. And that word latent, it just means it's present but not expressed. So it exists, but it hasn't manifested itself. So it's latent, it's hidden or concealed. One of the common treatments for this is something called penicillin G, and it's usually administered through an injection. Could be intravenous, intramuscular, and it's poorly absorbed orally is the reason they usually do it through an injection, because it degrades. Penicillin G degrades readily in the stomach acid. So that's why they usually do the IV form. Now, if a woman is pregnant, they need to be treated with penicillin G as soon as possible if they're thought to have syphilis, because you don't want it to spread to the fetus. So if it does progress, it will go into what's called the tertiary stage. And some of the images on the next slide, if you want to skip through, are pretty intense, so you might want to skip them. But in this tertiary stage, this will occur in less than half of the untreated cases. Again, about 30%. Occurs only after an interval of many years, which we looked at was about 2 to 4 years. And symptoms are due to the body's immune reactions to that treponema. So you get these inflammatory responses. Phagocytic neutrophils and macrophages are trying to kill the treponema. And during that process, you're going to end up with these gumas, which are these rubbery lesions. It can ulcerate in the mouth, in the top of the mouth, and you'll get these perforations, which we'll show you on the next slide if you want to skip it. So it can weaken the aorta, it affects the heart, it can affect your nerves, which is going to affect your motor control. It can even cause brain changes where you get different personalities expressed. You get these personality changes. And then it can also cause blindness or seizures. So it's affecting the nervous system, it's affecting the circulation, it's affecting the cardiovascular system, and even your digestive system, at least in your mouth. So here's some images of what that tertiary syphilis looks like. When you get that perforation in the palate, it's going to start to show up on your skin, and then in your nervous system as well. So really intense. So for congenital syphilis, this would be a dangerous form that is transmitted across the placenta to the fetus. And this is going to primarily cause neurological problems for the offspring. So this occurs when the pregnancy or when the latent stage in the mother is during pregnancy. And these pregnancies usually result in stillbirths. And you'll see that term miscarriage and stillbirth. And the difference is a miscarriage would be the loss of a pregnancy before 20 weeks of gestation. And then a stillbirth would be the loss of a pregnancy after 20 weeks of gestation. So basically a miscarriage is just an early pregnancy loss. A stillbirth is a late pregnancy loss. So one of the ways they diagnose this is the VDRL, or Venereal Disease Research Laboratory test, or the RPR, which is a rapid plasma reagent test. So that RPR test, it doesn't actually detect the bacteria. Instead, it looks for antibodies in our body that were produced in response to our damaged cells and the lipids that were released by the bacteria. So they're trying to see if the person has those antibiotics. So there's some antibiotics that can be used. Gonorrheal treatments usually do not affect syphilis because they're administered for too short a period to affect the slow-growing spirochete. So then for LGV, which we talked about, that lymphogranuloma venereum, again, this is more common in those tropical, subtropical regions, and it comes from that trachomatis. And we already discussed that, and it can be corrected by surgery. So last term here, our last disease would be something called bacterial vaginosis, and this would be inflammation of the vagina. It's most commonly going to be caused by these three organisms: Gardnerella vaginalis, Trichomonas vaginalis, and Candida albicans. So for vaginalis, that can help you remember that it causes vaginosis. So those two should be easier to remember. And then Candida, think about yeast or a fungus, and we think about a yeast infection, which can often occur in the vagina. So that can help you remember that it causes vaginosis. So to remember those three bacteria, you can think of those terms. And this is going to be characterized by a vaginal pH of 4.5, a fishy odor, and a frothy vaginal discharge. Lactobacillus is a very part of the normal flora of the vagina. So that's the good bacteria. If that goes down, then the pH can go up, which can affect the fungus growing and these other opportunistic pathogens taking over. So it can be sexually transmitted, but can also occur in sexually inactive women when the conditions change. And that is it for this lecture.